So the first extreme symptom that I saw Anya exhibit, she had a look on her face that I'd never seen before, like dread, flatness, unbelievably ominous.
My son David is autistic, and so some of the symptoms he was displaying are very similar to what you see in a lot of autistic kids.
My dad, Jeff, was diagnosed with a traumatic brain injury, or a TBI, after he was hit by a car. His face was very dull. He just wasn't himself. He didn't have that same look in his eyes that he normally did.
Alyssa seemed to be belligerent. She was arguing with me all the time. She didn't want to work, and she wanted me to take care of her.
And looking back and now knowing his diagnosis of agitated catatonia, the first catatonic event he had was actually when he was 4 years old.
In hindsight, Anya had a lot of the symptoms from the Bush-Francis rating scale. There were different periods, like waves, where different expressions and symptoms would arise and then they would subside. There were periods where she could not communicate. Of course, at the time, I thought it was belligerence. I thought she was refusing to communicate. There was a time we actually wondered if she was possessed.
There were times that she would be very stuporous. She would be standing, just staring into space for long periods of time. There were other times she was in a frenzy and she was just nonstop talking and moving all the time. She wasn't able to express herself when she was asked a question. She would either repeat the question I asked or she would say, I don't know. She couldn't find her email on her computer. She got lost taking the dog out. She couldn't tell time. She wasn't able to groom herself, shower, wash her hair, find her clothes, or even get herself food or drink. She often had a grimace of terror on her face. You couldn't reason with her. She was in a loop thinking. She was out of touch with reality, and she would distort stories from the past that had an element of truth.
So you'd have a 2-hour conversation, and at the end of the 2 hours, you're feeling like, oh, I'm getting somewhere. She's understanding it. And then, boom, she'd go right back to that topic as if nothing you said penetrated the conscience. Very hyperverbal, hyper movements, aggressive, verbally aggressive, and completely socially unaware. She'd return to the same topic over and over. One of her key topics was that her life was over. It was ruined. It was too late. There was nothing she could do to fix it. That thought then naturally led to the suicidal determination. She had 5 actual plans. I intercepted 3 of them. Sadly, 2 of them were not. Both of them should have killed her, and she was on life support, ECMO, and a ventilator for something like 7 days.
He had a very, very flat affect. He had really difficulty walking. We'd have to help him with very simple everyday tasks. He'd hold his arm in an awkward position, or his leg would be in a weird position. And what really was the very hallmark symptom, at least for my dad, was echolalia.
ADHD, selective mutism, bipolar,
Anxiety, depression, a spiritual crisis, bad genes,
schizophrenic, severe anxiety disorder, and major depressive disorder.
ADHD, generalized anxiety disorder, autism, bipolar disorder,
delusional, psychosis, borderline personality disorder,
major depression, which was something that struck our family as difficult because he'd never had any psychiatric symptoms, in his whole life. What really cured my dad of catatonia was ECT treatment.
The ECT was successful.
Ativan was helpful only at high doses. ECT was highly successful. It cured her.
David receives ECT on a maintenance schedule.
Alyssa would have ended up in a group home, or even worse, she potentially could have died.
Anya would have died, for sure.
He would not be living with us anymore. He was getting too aggressive to himself and to us.
He certainly would have died. We had a meeting, my mom and my sister and I had a meeting with the palliative care team at the hospital, and they told us to start thinking about saying our goodbyes and figuring out next steps.
David is doing great now. He has not been hospitalized since he was 14.
She's in college. She's got a great group of friends. She's got a great boyfriend.
She's thriving in every aspect of her life.
He's back to himself. You know, for a while, that didn't seem possible.
Catatonia is very real and has way more dynamic expressions than what people typically know.
When a patient has a sudden change that involves both movement and behavior, or one of them, that's completely out of context with what's going on, that they should consider catatonia.
Keep catatonia on the differential and not think of it as a zebra diagnosis. An Ativan challenge is such an easy thing to do. If you think catatonia is any piece of it, do the Ativan challenge. I think routinely using the Bush-Francis scale to kind of screen patients for any catatonia would be so helpful.
Get input from the patient's family and caregivers, because a 10-minute snapshot of what's going on when they're evaluating someone based on the rating scale isn't going to give them the full picture, because the symptoms do fluctuate over time. Both lorazepam and ECT are very effective first-line treatments, and to use those treatments first.
There is still the stigma that ECT is like one flew over the cuckoo's nest, and that it is a punitive thing. And it's not. It's done very gently.
Consider that catatonia is a standalone issue.
I wish that somebody would have mentioned some of these catatonic symptoms to us, that we could have considered that maybe that's what was going on with him, because that could have, saved us months of really difficult times and really hard treatment on my dad that didn't work.
My wish would be that any physician who is responsible for the care of a patient, that among his skills is that he recognizes various forms of behaviors that are abnormal and recommends effective treatment. But that's the role of a physician. His goal is to make a diagnosis and identify a illness for which that we have a treatment. And any physician who recognizes catatonia has an effective treatment in his hands. And so I would say catatonia is a treatable syndrome.